Children's Hospital has positioned themselves to take physical health care and behavioral health care, mental health care, and work together to create a seamless system for kids.
Our entire goal with this project is to break stigmas and to make sure that we are seeing behavioral health as the same as physical health.
1 in 5 young people suffer from a significant mental illness that causes significant impairment. And half of kids who have a mental health condition do not get any treatment at all.
So the 7th floor is actually where we have 2 of our main inpatient units. One is a unit for our kids who are age children and adolescents, sort of our general unit, which is our 7B unit. Our 7A unit is the unit for our kids with neurobehavioral issues, autism spectrum, and developmental issues. Sometimes to keep things safe, use some pretty strong stuff. So this is, extremely strong screen material to keep kids from being able to come out or leave. Yet you can see that we got a great view, and you have fresh air and a chance to. These kids oftentimes really enjoy movement or sort of swinging or play, and so where we have this special area. We actually allow a parent to stay with the child if it's therapeutically appropriate. You have to make them completely safe, which means nothing that somebody could use to hang themselves. So that's why we have it's a relatively spare approach. So if any sort of weight is put on it, it pretty much falls off. We're opening this in phases. So on the 8th floor, we actually have 2 other units that will be built that we're not staffing initially. Unfortunately, one of the main stories that goes with this is there aren't enough trained personnel who are good and interested in working with this patient population. And so we don't have enough psychiatrists, we don't have enough nurses, we don't have enough therapists to open up every unit all at once.
Half of all mental illness starts by age 14. And 75% by age 24. So really, if we're going to affect sort of the long-term effects of mental health conditions, we actually need to address it in childhood and teenage years.
The fact that they have put so much money and energy into creating a mental health hospital or behavioral health hospital for kids it's huge. It is really huge.